Welcome to Skill Up Nursing. This is Zina. It's been such a long time. I did not post anything online to my YouTube channel. My apologies for that. So, today I'm going to talk about one of the most important, even if you prepare for your OSCE examination, clinical placement, or you're a grad nurse. When you're in a nursing profession, these are very important five patient safety every nurse must do before performing any procedure. Okay, no matter what it could be, it's maybe someone is watching you, someone is not watching you, but just follow these things every time you are trying to do anything on the patient, any procedure. Let's get started. Why this matters to you? Okay, why this safety matters to you? Okay, now why do you think safety matters when it comes to maybe I did the question wrong. Why do you think the patient safety matters? We are human being too. Humans can make mistakes. Yeah. Similarly, we do not want to make mistakes anything on the patient. Okay. So that's why it's very important. Safety is number one thing when it comes to the clinical placement or when you work as a nurse. Patient safety is the foundation of quality nursing care. Every action you take before, during, and after patient contact has the power to protect lives, prevent harm, and build lasting trust between nurses and the patients in the Australian healthcare system. Now, the simple things are it protects your patient, reduces the risk of harm at every point of care, okay? Prevents avoidable errors. Systematic checks stop mistakes before they happen. When I say systematic checks, when it comes to the medication, there are couple more steps you have to do when it comes to the medication. Okay, we'll go through in next videos. And it also builds the trust between you and the patient. Okay, patient also will be aware when you check these. Oh, she's professional or he's professional. Okay, improve communication, clear handovers, and checks reduce misunderstandings. Sometimes you may notice same patient names in the same ward. Okay, so in during that time you have to be more aware about these safety concerns. Deliver safe care. Safety checks ensure consistent, high quality outcomes. So there are procedures like blood transfusion, medication, any invasive things. We have to be more concerned. We have to be more alert. Okay. So as I said, there are five things you have to perform before any procedures. They are non-negotiable. They are non-negotiable. So it has to be automatic. Okay, when you practice as a nurse, this is a lifelong procedure until you retire. Okay, in your nursing field. So the first thing is we all know. We all know what it is, hand hygiene. Hand hygiene is the one of the most important, sometimes most missed, you know. At sometime you could be busy. When you're busy, do you think that you perform hand hygiene? I'm not sure. Okay. Yes, but we have to. As per five moments of hand hygiene, which I have listed them, and you also know what are they. So you have to perform hand hygiene before you touch the patient. Okay. So before even you enter the patient room, there are hand scrubs or washing machine or whatever in hospital and healthcare system everywhere is set up in such a way that it is you can reach them. Okay, every point of care. For example, hand rubs when you enter the patient room, it will be kept. At the end of the patient bed, it will be there. Near the patient bedside locker, it's there. Yeah. So that means you can think how important it is the hand hygiene. Hand hygiene do not only protect the patient but also protects you. Yeah, you will need to remember. And most importantly, gloves do not replace hand hygiene. Always perform hand hygiene before and after gloves use. Okay, this is the first one, hand hygiene. Do not forget. And this is a non negotiable task. Okay, the next thing is introduce yourself. This is one of the basic thing. We always, even if the guest comes, if you don't know the person who is, you introduce. Similarly, you introduce yourself to the person who receives care from you. Sometimes I always show my ID card. My name is Zina. Sometimes they say Veena, Veena, Reena, whatever. But I always tell my name with the ID card. I show my name. Or then they say, oh, Zina. Okay. The Princess Warrior. You should Google who it is. But, anyways, introduce yourself to the patient and your role. And also, sometimes when I introduce myself, I also tell the list of plan what I'm going to do for the patient on that particular day. Okay, so very important. Okay, and also it builds the trust between you and the patient. You also initiate therapeutic communication between you and your patient, and patient understands what's your role while they stay in the hospital. Okay, this is another simple thing what we can do. Next is confirm patient identity. Yes, confirm patient identity. Always patient has a wristband. Okay, sometimes it could be white or it could be red. If the patient has red, yes, ask what are they allergic for. If the patient has white, still ask, do you have any allergies? And when you confirm the patient, you can ask the patient if the patient is able to tell you the name, date of birth. Sometimes MRN number, they wouldn't know what number. It's 5 to 6 numbers. You can confirm, you ask them, would you mind checking the wristband? Yes. Okay, the one more thing I want to tell you. When I was assessing the students during the simulation in the lab, if the wristband is not there in the one arm, they presume that there's a wristband. But believe me, during your simulation or your OSCE examination, there will be always a wristband, either on the left side or the right side. Okay, don't just because you have to show this thing to the examiner, you're checking the wristband doesn't mean that you have to just see and the wristband is attached to the other arm. And the student says, oh, okay, I'm checking the wristband. Have you? No, you haven't checked the wristband. Patient has a wristband on the other arm, and how can you tell the examiner, I checked the wristband? No, the wristband is on the opposite arm. So make sure you go to the opposite arm and check the wristband. Okay, confirm the patient identity. So usually the name, date of birth, and UR number or MR number. Always confirm the patient identity to prevent any errors. And the next thing is gain consent. Now you did the hand hygiene. You have introduced yourself and also you check the patient. Can you directly jump on the patient? Oh, just give me your arm. You cannot do that. Even if you have to raise the head end of the bed, tell the patient, I'm going to raise the head end of the bed. Would you mind? Sometimes patient may not like it. Sometimes patient may not have a clue that you're going to raise the head end of the bed. They must be thinking, what's going on? In that situation, gain the consent, whatever procedure you're doing. It could be a minor thing or the major procedure. Talk to the patient. Yes, explain what you're doing to the patient. Even if you're simple touch, let the patient know that you're touching the patient. Let's say you're checking a simple thing, checking the heart rate. Tell the patient, I'm going to check your heart rate. I have to place my fingers on your wrist. Yes, patients are very, um, you may not get all the patients always welcoming. That's the different thing. But majority of the time, they are very sick. They need your hand. Okay, they wouldn't say no to you unless the patient has got other mental health issues. In that way, it's a different approach. It's our duty of care to look after them. However, I'm talking about a straightforward patient. Explain the procedure clearly, explain the purpose and expected outcome. Check patient's understanding, whether patient understood what you said. Gain verbal or written consent. That is for the surgery or whatever. For surgical consent, normally we can explain, but we do not take the consent. It has to be done by the anesthetist. Answer all patient questions. Under your scope of practice, you answer them. Okay? The next thing, the other thing, we have a tendency to forget, to close the curtain, to provide, because we want to finish our task. At times, not always. We are very busy. We have 5 patients during the day, 4 patients, different, it depends upon the activity, and 8 or 10 patients overnight. Yes, we do. Also, we have to understand we are looking after human beings. They are lying down on the bed with a gown, very scared, frightened, very anxious, nervous. On top of that, we are performing procedure. Could be physical examination, could be blood pressure, could be some dressing or anything, and we are keeping them half open, exposing. What if it was just me? Do you think I need to be covered? Yes, I do. Yeah? So, in that situation, make sure, tell the patient, I'm gonna shut the curtains. Yeah? Always respect every patient's privacy and dignity, which is a fundamental nursing responsibility. It, it may be before or during the care. We have to take highest, what do you call, uh, out of words. We have to be responsible for these things. Okay. The next thing, what would be the takeaway thing? So, before takeaway, I just want to summarize. Before you perform any procedure, anything, make sure what we are going to do first, hand hygiene, identity, gain consent, then what else? Ensure privacy and dignity. Okay, I forgot about introduce yourself. So again, I'm going to repeat hand hygiene, introduce yourself, confirm the patient identity, gain consent, and ensure privacy. Safe care is equal to better patient outcome. Follow for more nursing education, skill up nursing with Sina. Okay, now Thank you for staying with me during this video session. I'm gonna upload more and more interactive sessions hereafter. Stay with me. Now, the other thing I want to tell you, these five things, no matter what procedure you're performing, could be OSCE examination or whatever, just list them. These are the important thing we are going to focus on. Have you checked patient properly? Have you introduced yourself? Have you done your hand hygiene thoroughly? Have you done hand hygiene as per the 5 moments of hand hygiene? Okay, let me give an example. You shut the curtain after touching the patient's surrounding. Did you do the hand hygiene again? Because you must be thinking you did a hand hygiene before you enter the patient room. But again, as per 5 moments of hand hygiene, you touch the patient's surrounding. Then again, your hand hygiene. Hope you understood this concept. Thank you for watching. And if you think that this session helped you, subscribe. I'll upload more and more sessions. Let you can also comment what session you need. I will try to prepare a session out of that and I'll upload it on my YouTube channel. Thank you.